Hey everyone, you've got a headache, so you grab some ibuprofen. You feel sore after a heavy workout, so you swallow a naproxen. Your doctor has you on a daily pill for chronic acid reflux. These actions seem completely benign, a routine part of modern existence. But what if I told you that for a person with diabetes, some of these ordinary, easily accessible medications could be stealthily damaging one of your most crucial organs, your kidneys? Today, we're going to have a profoundly serious and vital discussion. We'll explore common drugs and substances that can be toxic to the kidneys, a condition known as nephrotoxicity, and we're going to examine why the diabetic kidney is uniquely vulnerable. Hello, I'm Dr. Paul Prince, and this is the Diabetes Digest, your go-to source for clear, evidence-based health insights. Now I want to address the title of this segment directly. The word destroy is very potent, and I used it on purpose to capture your attention. Let me be perfectly clear, this video is not meant to inspire fear or prompt you to stop taking your medications. Its sole purpose is to build awareness. The truth is, these drugs do not inherently harm the kidneys in every single individual. However, they do carry risks, particularly with prolonged use, high dosages, dehydration, or when existing kidney issues are present. My pledge to you today is to provide the essential information you need to use these common drugs safely. You will finish this video feeling empowered to protect your kidneys and to have a more informed conversation with your physician. Let's dive right into the list. 1. NSAIDs, non-steroidal anti-inflammatory drugs. What they are. This is arguably the most widespread and significant category of drugs on our list. I'm referring to over-the-counter pain relievers such as ibuprofen, Advil, Motrin, and naproxen, Aleve, naproxen. Why you might take them? For practically any ache or pain, including headaches, arthritis, muscle soreness, or menstrual cramps. How they can harm the kidneys. Your kidneys are a dense network of countless tiny blood vessels that serve as filters for your blood. To stay healthy, they require a robust, steady blood flow. NSAIDs function by blocking prostaglandins, but these very same prostaglandins are responsible for keeping the blood vessels supplying the kidneys wide open. When you take an NSAID, it can cause these vessels to narrow, which restricts blood flow to the kidneys. For a healthy person, this is usually not an issue with short-term use. But in a diabetic kidney that might already be compromised, or with chronic high-dose use, this can lead to acute kidney injury. The doctor's recommendation: for sporadic mild pain, consider using acetaminophen, Tylenol, first, as it does not impact kidney blood flow in the same way. If an NSAID is necessary, use the lowest effective dose for the briefest possible duration. If you experience chronic pain, talk to your doctor about safer long-term options. Never use NSAIDs if you are dehydrated. 2. Proton pump inhibitors, PPIs. What they are. These are extremely common medications used to manage acid reflux, GERD, and heartburn. The most well-known examples are omeprazole, Prilosec, esomeprazole, Nexium, and lansoprazole, Prevacid. Why you might take them: for persistent heartburn and acid reflux symptoms. How they can harm the kidneys. While PPIs are generally safe for a short period, numerous large-scale studies have linked their long-term use, over a period of years, to an elevated risk of developing chronic kidney disease. The main mechanism is thought to be a condition called acute interstitial nephritis, which is a type of allergic inflammation in the kidney tissue that can lead to scarring and irreversible damage over time. The doctor's recommendation: PPIs can be lifesavers for certain conditions, but they should not be used indefinitely without a clear medical justification. If you have been taking a PPI for several months, Have a conversation with your doctor. Ask the question, do I still need to be on this medication, or can we look at other alternatives or lifestyle adjustments? 3. Certain antibiotics, what they are. Not all antibiotics are a concern, but certain classes are known to be potentially nephrotoxic, especially at high doses or in a hospital setting. The classic examples are the aminoglycoside class, like gentamicin, and the powerful antibiotic vancomycin. Even common antibiotics like sulfur drugs and ciprofloxacin can pose a risk in rare cases. Why you might take them: to treat serious bacterial infections. How they can harm the kidneys. These drugs can directly damage the delicate tubules and filtering units, glomeruli, within the kidneys as they are being processed and excreted. The doctor's recommendation: you should never refuse an antibiotic that is vital to treat a serious infection. However, you should be your own advocate. When your doctor prescribes a new antibiotic, it's always smart to ask, is this medication safe for my kidneys? And to make sure you stay well hydrated throughout the treatment. We're about halfway through. Before we continue, I want to hear from you in the comments. Which of these has been the most surprising to you so far? Is it a medication that you or a family member takes regularly? Let's talk about it. 4. Contrast dyes for medical imaging. What they are. This is not a drug you take at home, but a substance you're given in a hospital or imaging center before specific scans like a CT scan or an angiogram. This iodine-based dye helps make your blood vessels and organs visible on the scan. Why you might get it: to check for blockages in the arteries of your heart, legs, or to get a detailed view of your organs. How it can harm the kidneys. The dye is filtered out by the kidneys, and in some individuals, particularly those with pre-existing diabetes or kidney disease, this process can cause a rapid decrease in kidney function known as contrast-induced nephropathy. The doctor's recommendation. Your radiologist will almost always check your kidney function with a blood test before administering contrast dye. But you must be proactive. Always let the doctor ordering the scan and the technologist performing it know that you have diabetes. They can take extra precautions, such as hydrating you with an IV drip before and after the procedure to protect your kidneys. 5. Mismanagement of diuretics, water pills. What they are. These are common blood pressure medications like hydrochlorothiazide, HCTZ, or furosemide, Lasix. Why you might take them: for high blood pressure or to treat fluid retention, edema. How they can harm the kidneys. Diuretics themselves are not directly toxic. The danger arises from their effect. They make you urinate more to eliminate excess fluid and lower blood pressure. However, if you become dehydrated due to a stomach bug, excessive sweating in hot weather, or simply not drinking enough water, taking a diuretic can put immense strain on your kidneys, leading to acute injury. The doctor's recommendation. If you are taking a diuretic, hydration is non-negotiable. You must be diligent about drinking enough water every day. If you have any illness that causes vomiting or diarrhea, call your doctor. They may recommend that you temporarily stop your diuretic for a day or two until you are rehydrated. 6. Certain herbal supplements. What they are. This is a vast category. Many people assume that because a product is natural, it must be safe. This can be a perilous assumption. Some herbal supplements, especially those from unregulated sources, can contain heavy metals or have direct toxic effects on the kidneys. A classic example is any supplement containing aristolochic acid, which is a known nephrotoxin. Why you might take them. For a wide range of health reasons, often without a doctor's recommendation. How they can harm the kidneys. They can cause direct cellular damage, inflammation, or interact with your prescription medications in detrimental ways. the doctor's recommendation. This is simple and definitive. You must tell your doctor about every single supplement, herb, and tea you are consuming. Do not assume they are harmless. Your doctor needs the full picture to keep you safe. 7. Your own diabetes medications, if not monitored properly. What it is. This is the most complex point. Drugs like metformin or the newer SGLT2 inhibitors like Jardiance or Farxiga are actually kidney protective in the long run. The danger. The risk emerges if your kidney function has already declined significantly and the dose is not adjusted. For example, metformin is cleared by the kidneys. If your kidney function drops below a certain level, the drug can build up in your system, raising the risk of the rare but serious side effect, lactic acidosis, the doctor's recommendation. This underscores the critical importance of routine checkups. Your doctor should be checking your kidney function, your GFR and creatinine levels at least once a year. This allows them to adjust the doses of your diabetes medications to match your kidney's current capacity, ensuring that these beneficial drugs remain safe for you. My final clinical takeaway. The common thread throughout all of these points is not that drugs are bad. The theme is communication and awareness. Your role as a patient is not to be your own pharmacist, but to be an informed partner in your healthcare. Protecting your kidneys is one of the most important things you can do while managing diabetes. This isn't about being scared of medication, it's about being smart, vigilant, and proactive. Be the CEO of your health and be the guardian of your kidneys. If this deep dive has empowered you with new knowledge to protect yourself, then I invite you to hit that subscribe button and ring the notification bell. Join us here at the Diabetes Digest for more information that puts you in the driver's seat. For today's question, what is the single biggest takeaway for you from this video? What is one thing you will do differently starting now? Share it in the comments. Thank you for being here today. Now that you know about the external things that can harm your kidneys, it's crucial to be able to recognize your body's own internal warning signs. I highly recommend you watch the video on the screen now. This morning habit reverses insulin resistance and fixes your hormones. It's the perfect follow-up. Click on it and I'll see you over there.